So the next procedure I'd like to go over with you is using an electric razor. So before you begin any procedure, make sure you do those initial steps. Ask your nurse about your resident's needs, abilities, and limitations. Knock on the door, request permission before entering. Greet them by the name they prefer. Identify yourself by name and title. Explain everything you're going to do. Find and gather your supplies. So for electric razor, I need my razor. I need pre-shave lotion that's made specifically for electric razor use. A towel and some gloves. I'm going to provide for privacy, close the curtain drapes and doors. I'm going to wash my hands, wear gloves as needed for body fluids, and I'm going to use good body mechanics. So before starting, I need to make observations. I need to make sure there's no pacemaker, oxygen, or water in use. So the acronym we use for that is POW, P-O-W. If they have a pacemaker, using electric razor could cause an irregular heartbeat. Oxygen, they could combust and catch on fire. And water, obviously, would be electrocution. So I have none of those things. I'm going to put a towel underneath my resident's chin. I'm going to put on some gloves. You know, sorry guys, I kind of miss the powder because when your hands are damp, sometimes these are fun to get on. Alright. They do make what we call a pre-shave lotion specifically made for electric razor use. Now, not every resident has this, but if they do, use it because it makes shaving their face so much easier. It makes the hair stiff, and that way it kind of sticks up a little bit and you get a nice smooth shave. So if they have pre-shave lotion, you want to apply that to the face and neck. And an easy way to remember how to use an electric razor is you just shave in the direction that the blades are shaped. So with a razor like this is a circular razor because it has circle blades, so I'm going to shave in a circular motion. Some of your razors are foil razors, so they kind of look like a square and they have two tubes that roll. If you have that type of a razor, you shave in the direction that the hair is growing. So for a circular headed razor, I'm going to hold the skin taut, which just means tight, and I'm going to shave the face and neck in a circular motion without dropping it on the resident. I would pat them dry. Aftershave lotion is their request. If there were any nicks or breaks in the skin, I would report it to my nurse. I'm going to take off my gloves. I'm going to wash my hands, and then your final steps. A, check alignment, make sure they're comfortable. B, make sure your bed's down, side rails is appropriate. C, make sure they have their call light and water. D, ask them if they need anything else before you go. And E, everybody likes a thank you, so thank your resident. F and G, find and gather your supplies, clean them to company or facility policy. H, ask them how they want their hanging curtains, open or closed. And then I your way out the door. I'm going to wash my hands. I'm going to do a visual safety check. I'm going to report unusual findings to my nurse, and then I'm going to document my procedures. Thanks for watching.